All right. Hello and welcome to the open enrollment question and answer session. I'm Carly Deathridge. I'm the Assistant Director in the Office of Health Promotion within the Center for Counseling and Wellbeing. Today, we will be answering questions and providing you with more information about health insurance and your options as a college student. Alyssa Danker, who is the Center for Counseling and Wellbeing's case manager, will be asking questions to Stephen Goldman, who is a variety care navigator, and Rebecca Guanshaw, who is the clinic manager at OU Physicians Clinic, which is here on campus located in the Wellness Center. I want to thank Rebecca and Stephen for being here today, for taking time to answer questions and providing our students with information that will help them navigate health insurance. If you all are watching this video and afterwards you still have additional questions, feel free to reach out to the Center for Counseling and Wellbeing, and you can call us at 974-2215. All right, Alyssa, take it away.
All right, thank you, Carly. And thank you, Steve, for being with us here today and answering questions that our college students may have. So the first one I have is just in general, what insurance options are available to college students?
Thanks so very much. I should do an update. I'm now with Legal Aid Services Navigator Program, which is nonprofit help with health insurance. And Variety Care is one of two community health centers in the Oklahoma City area, part of a network that's statewide. And we need to make a distinction between getting health care and getting health insurance, because you don't always need health insurance to get health care. And that's where the community health centers like Variety Care and Community Health here in the Oklahoma City area come in. They offer basic primary care health to people without insurance, and you pay on a sliding scale based on income. So a lot of students use that services. Again, here in the Oklahoma City area, there's Variety Care and Community Health. And I'll give you a couple of phone numbers because these community health centers operate like a regular physician's office. You call, you make an appointment, you have a particular time that you see somebody. So Variety Care is area code 405-632-6688, and Community Health is 405-769-3301. I encourage folks to try both because they have offices in different parts of town, and one place might be able to see you sooner than another. Also across the state, there are community health centers that again see folks on a sliding scale payment basis. Many offer lower cost pharmacies, dental, vision, and behavioral health services as well. So that's the distinction between being able to get health care and health insurance. And health insurance is a financial plan that you buy. And it kind of has two components. One is you're paying a monthly membership fee, almost like Sam's Club, to have access to lower prices for both drugs and for medical service that the insurance company has negotiated for you. So right from the start, you pay a monthly premium, but you get access to the lower prices for seeing a doctor, for an x-ray, for medications. The other part of health insurance is setting a ceiling on your costs, that you're paying this insurance and the insurance sets a maximum amount that you would pay. And it might be really high, like $8,000, but if you're getting a $20,000 surgery after a motorcycle accident, then $8,000 is not a bad deal. But that's what health insurance does, is it sets a ceiling on how much money you would pay in a year. Now, different than car insurance or home insurance, you don't have to pay that deductible or that maximum if you don't use that amount of services. You pay as you go in these systems, but it sets a cap on how much you'd ever have to pay. And again, that's different than car or auto insurance. It sets a cap on what the insurance company would pay. In health insurance, you're paying for a cap on how much money you would ever pay as well.
Thank you so much for those distinctions in the available options for students. For our students who may not know what sliding scale, like sliding scale payments are, can you explain that a little bit to them?
Right. That the price you pay for services or medications is set by your income, how far above or below poverty level you are. Everybody pays a little something, but it's a sliding scale where folks at higher incomes pay higher. So when you call a community health center, don't be surprised if they ask, well, how much do you make? That's so they can tell you your prices.
All right, thank you. And what do you recommend for our students who are unemployed? What do they do?
Anyone who's unemployed, the community health centers are available. And again, they'll ask your current income and you'll pay based on that price. Now, interestingly, in the marketplace, the healthcare.gov marketplace, unemployment counts as income. So
Oh,
especially this year, we're seeing folks who maybe worked 4 months of the year in 2020 and then got unemployment, and the amount they worked plus their unemployment puts them above poverty level, above about 13,000 for a single person, and that qualifies them for the big discounts on the marketplace.
oh wow. So are there any things that would disqualify a person from being able to get insurance coverage?
There's nothing that disqualifies someone from getting coverage, because with the ACA healthcare.gov, pre-existing conditions are included. There's no questions about your health conditions or your medications, only about tobacco use, and folks who use tobacco pay a higher premium. So
Okay.
folks can get coverage, especially now during open enrollment, which ends December 15th, which is the one time of the year anybody can go get insurance. The restrictions are on who gets discounts, who
Okay.
gets the tax credit discounts to lower the price of monthly premiums. And the rules there are you can get discounts if you don't have the option of other insurance. If your job doesn't offer insurance, if you're under 26 and could be on your parents' plan, if you are eligible for Sooner Care Medicaid or Medicare, then you're not eligible for the financial aid discounts to lower the cost of premiums. So when we talk about students, for a student, there may be plans offered by their educational institution, but if not, in the marketplace and other health insurances, they're in that 19 to 26 young adult group, 19 being too old for Medicaid or Sooner Care.
Hmm.
And most parents' plans let the child stay on until age 26. So the distinction there becomes, is the student still on the parent's tax return, or are they independent of their parents? Somebody who's still on their parents' tax return generally then has access to their parents' insurance, whether the parent gets that from a job or from marketplace. But folks who are no longer on their parents' health insurance, no longer on their parents' tax return, then get their own health insurance based on their own income. And so it's not so much being a student or not, it's where you are in that 19 to 26-year-old range and whether you're independent of your parents' tax return.
Okay, wow. And let's say that after, comparing options, we have a student who decides that they want to enroll in an insurance plan. Where do they start?
Well, we recommend healthcare.gov because that's the whole statewide system. And you can look at plans and prices without giving your name and your address. And I'll give a special website where you just put in the information that actually determines the price of your health insurance. And that's age, zip code, or county, and whether you use tobacco or not. That's what determines the price of a plan. And then you put in the information that determines whether you qualify for discounts. And that's whether you have access to your parents' plan or a plan from a spouse or your job, and what your income is. So that website is healthcare.gov/C plans, and I'll spell that out. SEE-PLANS. SEE-PLANS. And you can get to that anytime. You don't give your name. You don't have to give your full address or email. You can just look at plans and prices. And for example, in Oklahoma County, there's 55 different plans from 5 different companies. So
Wow.
you get to shop and decide, do you want high deductible, low deductible? Do you want a plan that covers lots of different hospitals or only particular hospitals and doctors?
Okay. And thank you so much for that. I'm sure that some students, though, maybe it's their first time enrolling, they may want a little bit more support. So what are some of the places they can go to for that extra support and education on
Mhm.
enrolling?
On the healthcare.gov website, and be sure you type .gov so
Okay.
that you're going to the nonprofit website. There are lots of educational information there about health insurance in general. For in-person help, the Navigator program at Legal Aid is available, and I'll give you that phone number. And there's also a website. The phone number is 405-313-1780. Again, 405-313-1780. Or the website is myokplan.org. That's myokplan.org. You can also go to any insurance agent or broker, and there's a list on healthcare.gov also.
Okay, thank you. And then let's say a student has successfully enrolled in an insurance plan. Should they receive their insurance card in the mail, or is there anything else they should know about receiving their insurance cards?
That's going to be different for the different insurance companies that you sign up with. Some
Okay.
send a card right away. Some say we'll send a card after you make your first monthly payment. Some say, hey, it's all online. Just give them this number that they'll type in, and everything's online. The other thing to remember about health insurance is it's a big decision, and it's a year-long decision.
Mm,
That different than car insurance, you can't turn health insurance on and off. You
mhm.
have to pay it each month in advance for it to stay in effect. If you miss more than 2 payments, it can be canceled and not able to be restarted. So health insurance, take your time to choose something that works for you, does what you need, that's affordable for 12 months.
All right. And when do health insurance plans become effective once someone's enrolled?
Right now, we're in what's called open enrollment, which is the once a year period where everybody could sign up, even if you didn't have health insurance in the past. And that's November 1st to December 15th for coverage that starts January 1st. In other parts of the year, people who lose insurance can sign up for Marketplace. For example, if Sooner Care ends, there's a 60-day window to go sign up for Marketplace. If a job ends and insurance ends, then there's a 60-day window to go to Marketplace at any time of year. Also, tribal members can sign up at any time of year.
Okay, thank you. And then the last question we have is what other services does Legal Aid provide where you currently work?
Sure. Legal Aid provides a variety of legal services for generally low-income folks. They do non-criminal law, so all sorts of things having to do with domestic situations, economic situations, and you can find more information at the website, legalaidok.org. Again, legalaidok.org.
All right, thank you again for last time for, joining us. I think we'll have our next person on for a few questions, and then we'll bring you back at the end to see if there's any additional information we need. Thank you. All right, Rebecca, how are you?
Hi, good. How are you?
So I'm doing good. So you're with OU Physicians here on campus. So can you start with just letting our students know where are you located?
Yes, the OU Physicians Health and Wellness Clinic is conveniently located in the UCO Wellness Center, room 105. So when you walk into the building, into the wellness building, you just go slightly to your left, and we're just located just around the corner. And we are open from 8 a.m. to 5 p.m. Monday to Friday. And with this whole COVID situation, most of our appointments and our visits are done virtually at the moment. But you can give us a call. Our number is 405-271 8261, 405-271-8261. Give us a call if if you need an appointment or if you have any questions.
All right, thank you. So what medical services exactly do y'all provide at OU Physicians?
Yes, so we do provide wellness checks and preventative health exams, such as annual physical exams, well woman exams, including pap smears, sport physicals, and we do charge a flat fee of $25 for that. School physicals, SEI, STD testing, and we also do acute sick visits, urgent care visits such as upper respiratory infections, cold, flu-like symptoms, strep infections, gastrointestinal problems, muscle sprains or strains, and minor lacerations. We also do labs in-house. So we can do lab work here in the clinic, such as strep screening, mono screening, urinalysis, pregnancy tests, and blood sugar tests. We also offer vaccinations, immunizations. Right now it's flu season, so we do have the flu vaccine that we're offering. We also do TB testing and any other thing that you would need to go see a primary care doctor for. And one other thing that we have here in the clinic is we do have a licensed social worker here in the clinic. So we do offer mental health and behavioral health services as well, such as appointments or visits for anxiety, depression, or stress. So, and some things that we don't do here at the clinic that we can't offer is doing x-rays. So if you need an x-ray done, we would need to send you to another location or to another clinic. We can't do full facial lacerations or like complicated lacerations, such as a deep arterial wound. We don't do long-acting contraception such as IUDs. And we also don't have services for ADD or ADHD. So those are the things that we can't offer.
Okay, thank you. It does sound though that y'all do have a very wide variety of things that you can offer
Yes,
to the
we do.
students, a lot of services. That's fantastic. So for students who
Yes.
don't have insurance, can they still receive services from OU Physicians?
Yes, definitely. So yes, like what you mentioned, we do offer a wide of variety of services. And for those students who don't have insurance, we offer a sliding fee schedule. So what it is, it's a program for students who don't have insurances. So the fee or the charge for an office visit will be based on their annual income. So the price range for an office visit is between $10 and $60, depending on what their income is or where their income level falls into. But one thing that students need to take a note of about the sliding fee schedule is that there could be additional fees on top of the office visit fee. So for example, if a patient or if a student needs to do a pap smear, we will do it here in the clinic, and their office visit copay of say like $10, like say they fall into that income level, that $10 will cover the pap smear. However, like the specimen will be sent to a lab, and so there will be additional lab fees for that. So the same thing goes for any lab work, like such as STD testing, any blood work. So there's an additional lab fee for that.
Okay, thank you. And for students who, again, don't have insurance, and we talked about these additional fees, do y'all have any payment plans that they can join, or any low-cost prescription, or are you just very upfront with the cost before they get started? What do y'all do? How do you approach it?
Yes, so besides from the sliding fee schedule, like students who don't have insurance that have to pay like additional fees. Oh, can you hear me? Yeah,
Yes,
okay.
I can.
So
Yes,
for
you're
students
good.
who need to pay additional fees, okay, for students who need to pay additional fees, like say for a lab work, they get a discount. So if they need to do a lab work, they will get a 20% discount for
Wow.
that. And we also offer, let's see here, we offer a financial assistance program for those who need help. So if they need help, they just let us know. We give them the application and we send it to our billing, our finance department, and then they will process their application and they will be able to be informed, if they would qualify for the assistance. And you mentioned medication. Our clinic utilizes GoodRx. So what it is, it's a website where you can go into and get discounted medications or free coupons for medicines, for medications.
Wow.
And so our provider would actually, like help the students to go into the GoodRx and then give them the information that they need so they can get low cost medications.
Wow. Oh, that's amazing. And I think the last question we do have for y'all is for those who have insurance, what insurance does your facility take?
Yes, so we take most insurance plans such as Blue Cross, Blue Shield, Cigna, Health Smart, First Health, and under this First Health, we take ISO, which is the insurance for international students, United Healthcare, Humana, Aetna, Epic, Community Care, GHA, which is the Government Employees Health Association insurance, OHCA, which is Sooner Care. So if a UCO student has Sooner Care, we can accept that here. One insurance that we don't take here is Medicare.
Okay. All right. Thank you. So I think we'll bring the other two people back on the screen, Carly and Steve. Hello. So Rebecca and Steve, do you have any additional information you thought of that our students should know about?
I'll suggest that thinking about health in the biggest sense, that it's not just sickness, it's also getting hurt. It's not just physical health, but also mental health and behavioral health. And health insurance these days must include behavioral health. It's not anything extra that you have to ask for. It's there in the insurance plan. So whether you're on a parent's plan or picking your own plan, mental health, behavioral health is automatically included.
Okay, thank you.
Yeah, so just like what Steve said too, like mental health and behavioral health is also important, and we do have that in the clinic. So if you need any services for that besides for primary care services, do give us a call. And if you wanting to check us out, like you can access our information in the UCO website. If you go on the UCO website, go to Student Life, and then go to the Wellness and Sport section, and then you'll see there's a link for the OUP clinic, and so you can just click on that. We have information there, like our hours of operation, phone number to call. So yeah.
Okay, well, thank you all again for being here, Rebecca and Stephen, and great job asking those amazing questions, Alyssa. Again, for those of you watching, if you discover that you have additional questions or would like to speak to someone further about health insurance and options, you can call the Center for Counseling and Wellbeing at 974-2215. Thank you.